Hello, everyone. We'll take a few minutes just to let everyone continue to hop on here, and then we'll begin. Oh, thanks for joining. Okay, let's go ahead and advance to our next slide. Hello, thank you for joining us for tonight's webinar introducing free genetic testing for cardiomyopathy patients. My name is Nikki Butler, and I am the Director of Digital and Social Media for the Dilated Cardiomyopathy Foundation and the Genetic Cardiomyopathy Awareness Consortium. We're so glad you can be with us. We have tremendous interest in tonight's webinar. We have over 400 people registered at last count, and our team is very excited to share this important information with you tonight. I do have a few housekeeping items. All attendee microphones are on mute upon joining so that you can hear the presenters. Please enter your questions into the Q&A feature of Zoom at any time. We will hold a dedicated Q&A session at the end of the presentation. Next slide. Poll number 1. Let's push this forward. If everyone could take just a moment there and enter. We'd love to know who's attending tonight's webinar. Are you best described as a cardiomyopathy patient, a family member or friend, a medical professional, or an industry professional? Great. And it looks like we have about 51% cardiomyopathy patients, 15 family members or friends, 19% medical professionals, and 14% industry professionals. Very good, excellent, thank you. So let's keep rolling. I do want you to know that this webinar is being recorded, and it will be posted on our YouTube channel following tonight's discussion. As registrants, you will receive an email with a link to the recording. Our YouTube channel also houses a library of our previous webinar recordings. And using the auto translate feature, these videos are available in 54 different languages. So now I'll kick it over to Greg Roof, our Executive Director, to take it from here.
Nikki, thanks so much for kicking us off and helping put this together. Would like to thank Heather, which is behind the scenes helping us put on this webinar this evening also. And again, thanks to everyone that's joining this afternoon, this evening, about this really exciting program that we're going to talk about and much needed. A little bit of background, first of all, is that the Dilated Cardiomyopathy, the DCM Foundation, has actually created GCAC. In 2022, DCMF recognized that genetics in cardiomyopathy needed to be addressed. It was not something that people talked a lot about, not the medical professionals in this area, the patients. And then we also realized that when you're talking about genetics and cardiomyopathy, you can't really just talk about it as dilated cardiomyopathy, DCM, or hypertrophic HCM, or arrhythmogenic ACM, because many of the genes that mutate sort of cross boundaries and can cause, certain gene can cause dilated cardiomyopathy and cause arrhythmogenic cardiomyopathy. So when we were looking at cardiomyopathy, you're looking at genetic cardiomyopathy, you have to look at it on a cardiomyopathy-wide basis. So we formed the Genetic Cardiomyopathy Awareness Consortium in 2023 to address the lack of knowledge about genetics and cardiomyopathy in both the patient and medical communities. And I think in the last 2 years, we've come pretty far. I think the awareness about genetics and cardiomyopathy have increased dramatically. I know Stephanie Fallon, that runs the DCM Foundation, the DCM Facebook groups, has said that the verbiage that she's seeing talking about genetics and cardiomyopathy she's been doing this for 10, 15 years, increased dramatically the last couple of years. The group started with 8 patient groups that were joined, and today we have 11 patient groups. Next slide, please. Again, the Genetic Cardiomyopathy Awareness Consortium is comprised of 11 different groups, but it is brought to you and managed by the DCM Foundation. Next slide, please. The 11 groups that are participating in GCAC, for short, are the Children's Cardiomyopathy Foundation, Lamine Cardiac, Danon Foundation, Mended Hearts, PLN, SADS Foundation, DCM Foundation, Women Heart, Let's Talk PPCM, Team Titan, Heart Charge, and the Sudden Cardiac Arrest Foundation. And I really would like to thank each group for participating, for promoting this webinar, promoting everything that we're doing. It's great to have a coalition of 11 different groups working together to help solve a real problem with patients. Next slide, please. So we were spreading the awareness the last couple of years with GCAC, and the one thing that we saw though is that there needed to be more genetic testing. Current medical guidelines from the American Heart Association, American College of Cardiology, Heart Failure Society of America says that if you've been diagnosed with idiopathic or non-ischemic cardiomyopathy, which means we're not sure where your disease came from, where the disease cardiomyopathy came from, you should be genetically tested. But several studies have shown that only about 1% of the people are actually being genetically tested. Terrible. 99% aren't being tested. Amazing. And there's a real problem with this. We'll talk a little bit about that. One, decreases the speed of research. 2, decreases the speed of therapy development. And third, and I think probably most important, definitely most important, it puts patient lives at risk. Well, let me talk a second about that and why it's so important to get genetically tested. About 30%, or let's say a third, we'll round up a little bit, of all genes that can cause cardiomyopathy have the ability to cause sudden cardiac, dangerous arrhythmias or sudden cardiac arrest. And the nice thing is that if you have cardiomyopathy and then you found out that and you got genetically tested and found out that it's genetic and that it's a gene that potentially could cause sudden cardiac arrest, one, you could get an ICD to potentially save your life. And 2, have your family members tested so that you potentially could save their lives. This could possibly save tens of thousands of lives each year. Next slide, please. So the last couple years, we've been looking for a genetic testing service that we think would be best for cardiomyopathy patients. And one, we want it to be accessed directly by patients. Because the knowledge about genetics and cardiomyopathy really is very, very limited outside of major academic medical centers. So what we found is we'd have a lot of people that had 2 or 3 people in their family have cardiomyopathy, and their cardiologist says they don't need genetic testing, which is just absolutely incorrect. So we realized that in many instances, patients are going to need to be able to order this themselves in order to help themselves. Because again, still, unfortunately, a lot of cardiologists don't understand this yet. This also, when we're looking for a genetic test, it need to be extremely easy to use. I think you'll hear Megan and Jebs use the term frictionless. But most of the genetic testing out there is difficult from a technology standpoint and difficult navigating insurance. It needs to be affordable, if not free. For instance, we talk to a lot of patients, and even if they have health insurance, they still have to pay several $1,000s or more out of pocket in their annual deductible in order to pay for this. We don't think this is acceptable. And of course, it needs to be of the highest quality, medically available. Is it, and I think you hear Jeb and Megan talk a little bit about this later, but is it the best test available? Next slide, please. So GCAC is very pleased to and proud to announce that we found a genetic testing service that meets the criteria that I just mentioned. Everygene, which you'll hear about in a little bit, is a new genetic testing company that has agreed to collaborate with GCAC to provide currently 5,000 free genetic tests for cardiomyopathy patients. With additional funding, we'll be able to provide more and more testing, and we hope to be able to provide at some point unlimited testing, free testing to all patients. So, and by getting more cardiomyopathy patients tested, we know that we potentially can save thousands of lives each year. So we're really, really excited about this, to launch this service. Next slide, please. And we'll hear from the co-founders of Everygene. First of all, I'd like to say a little bit about both Jeb and Megan. One, they both are very, very purpose-driven individuals. The reason that they're in this space is to help people. We've had dozens, if not 100 conversations about this. A little bit about Megan. She got into cardiology because of a family member that had heart disease, and that's what drove her career choice. She spent as a cardiology certified nurse practitioner many years, different hospital systems, and even ran heart transplant programs at a couple different institutions. About 10 years ago, she moved into the space of biotech, biopharma, helping to introduce the great drug Entresto to the heart failure cardiomyopathy market. And then after that, worked with MyoKardia and mavacamten, introducing. The last 3 or 4 years, she's actually been focusing her career on genetic cardiomyopathy, and she was a behind-the-scenes co-founder of GCAC with me. The other co-founder and CEO of Everygene is Jeb Belice. And again, but he is very motivated by helping patients. He's been a successful entrepreneur in the consumer online sort of app business, building applications that consumers can use. The reason he started Everygene is because he was going through and needed his family to have genetic testing, he and his family, and found that it was very, very difficult to navigate and very, very frustrating. So he wanted to create a business that actually would be genetic testing that's patient-friendly and affordable. We're thrilled to have Megan and Jeb with us. And with that, thanks for being here, and I'll turn it over to you.
Thank you, Greg. Greg, can you just give me a thumbs up that you can hear me? Great. Thanks, Greg, and thanks to everyone joining tonight's webinar. Greg, a quick note, it's probably the first time in my life where I've seen one individual pull together technologists and patient advocacy groups and researchers and people working to cure disease, investors, and most importantly, patients, to all come together and try to push things forward faster. So just remarkable to see you do that. And on behalf of our team, we're excited to play a small role. As Greg said, I'm Jeb Belice. I'm the CEO and founder or co-founder of Everygene. The thesis that we started with was, wouldn't it be great if, because of the precipitous decline in the cost to sequence and test individuals, would we be able to offer that as a free service, knowing that the value created by giving individuals free testing far exceeds now the cost to test and sequence an individual. And so we're funded by patients who have almost all have cardiomyopathy, who want science to progress faster than it's currently progressing. And we see an opportunity to come together to push science forward faster and advance understanding treatments and cures faster. Move on to the next slide. So today I'm going to talk about why Everygene exists and why genetic testing matters. My time is going to be limited to about 5 minutes. At the end, I'm going to give a presentation or just a very quick demo of our website. It's a quick demo because it should be very easy to use and intuitive for you or your family member to get a genetic test very quickly. Megan will take over after one of the slides on genetic testing, and she'll bring us all the way down to not quite the Q&A because we have some other speakers, but at the very end, we'll be here to answer anyone's questions. If anyone has any questions beyond this webinar, please, we'll circulate Megan and my email address and phone number. We are here to take feedback of any kind and help in any way possible. Okay, so why every gene exists. This is just one slide. We're trying to make genetic testing routine in cardiomyopathy care. We want you and your healthcare provider to make informed decisions, the best decisions to protect your heart and allow you and your family members to live the longest life possible. Free is such a great hook in many cases where we can say, hey, we're offering free testing. And that's cool and that's great. And I'm proud that Greg mainly was able to help us do that. I think in our case, we're really trying to start a movement. We want genetic testing to be routine. So when a patient comes in to a cardiologist, that one of the first things that they do is provide that patient with a free genetic test to identify key variants that might cause heart failure or sudden cardiac death. And so we want that to be in routine care. And we want everyone, of course, I want everyone who's a patient to try our service and use our service and get as much out of our service as possible. But beyond tonight, we really are trying to begin a movement where this becomes routine. So why genetic testing matters. I'm going to do genetics 101, recognizing that many of the people here are professionals, but this is the way I understand it. And this is why it's so important for every gene, really. So every human being so biological mom and biological dad come together and make one cell. And the human adult is about 30 trillion plus cells. That by definition, that first cell has all of the instructions it needs to replicate from 1 cell to 2 cells to 4 cells to 8 cells, all the way to 30 trillion. And along the way, each of those cells has specific instructions of creating a heart or a brain, heart cells, brain cells, skin cells. And so learning that, I think for anyone, the first time they hear that, it's always remarkable. What's even beyond that, though, is we're in this really unique point in time where the cost of getting your genetic code, so it's 3.2 billion base pairs long, or really letters long, 6.4 billion letters long. It's almost like a computer code that our first cell has to make us who we are. And that's really remarkable. And I think now that the costs have come down, one of the things every gene provides you with is access and a downloadable access to your entire genome file. So right away, you should have that. It's stable. You only need to do it once. You should know the code that makes you, you. Just a couple facts about the genome that I think relate directly to how researchers are attacking solving problems to treat and cure disease. Researchers in the late 1980s x-rayed fruit flies to actually manipulate genetic code back and forth. And they recognized that when they flipped, when some of the genetic code came back from the fruit flies, that their tails were where their antenna should be, and their antenna should be where their tails were. And what that means is that your genetic code is actually read from left to right. And so knowing that you develop by every cell sort of reading this code from left to right, it starts to ask the questions of, well, if a cell is not behaving properly and not creating proteins properly, then could we go in and create a cure for that? And so I'll stop there, but I think the smartest people in the world in 2000 or way before 2000 understood all of this. And probably one of the smartest people on the planet, Francis Collins, I think head of the NIH and Johns Hopkins and so on and so forth, leader of the Human Genome Project, or one of them, he said by 2020, this was in 2001, we're going to have a gene-based designer drug available for almost any disease that you can name. And obviously he's brilliant, but off by a few years. I still believe that he is completely right. I think there are two things that maybe this sentence or this phrase did not capture. One is it takes really long time for drugs to come to market for a variety of reasons, but more importantly, the costs hadn't come down. If we were having this webinar 20 years ago, Greg would be sending out an email saying, introducing testing for cardiomyopathy for the low cost of $300 million. It wouldn't have worked. And so right now we are in this really unique point in time where we can actually get genetic testing done for free. And that's really a magical point in time. So I'm really just hoping we have success. By way of, the way you get to figure out what genes are what causing what disease is really by running a genome-wide association study. So you need to take a group of people that have a certain condition and try to identify the genes that are causing that condition by looking at their whole genome. And one of the most remarkable things, this is my last slide before I turn it over to Megan, is that researchers have made such great progress over the last 20 years identifying genes specifically that related to and causing cardiomyopathy. Like, the race is on now to really solve heart disease and the nation's #1 killer. And we, me being a minuscule part, but researchers and scientists are now like getting closer to understanding the way these diseases develop and can be treated and cured. And so we've created the Every Gene Cardiomyopathy Gene Panel in collaboration with Mass General Brigham to the latest research possible that have 50 genes that are related specifically to causing cardiomyopathy. And our panel is going to be regularly updated to reflect new discoveries, ensuring critical genes aren't missed. I'm going to stop there. Just thank you, Megan. I'm going to turn it to you. And I look forward to presenting you our website in a few minutes.
Thanks, Jeb. You can move to the next slide there. Okay, so I think Jeb did a really good job in understanding and explaining the basics of how our body has instructions to help us do and work the way we're supposed to work. And the reality is genes really serve as that instruction manual. And sometimes the instruction manual can have a typo. And what you saw in the previous slide are the genes that they have now discovered that are linked to cardiomyopathy when there is a change or a variant. You might hear the word variant. When there's a change in these genes, then you start to see disease. And so the benefit of getting tested is not just establishing the root cause, but some of the things that we've had a lot of questions on is like, what's the point of testing? How will that help me out? And so the Every Gene panel does reflect everything that is most current in the research, but the question is, if you get your testing done, what would you do with it? So I think it's also really important to point out that about half of the genes that were on that were on the panel there are associated with sudden cardiac death and arrhythmia risk, and those are identified not only by extensive research but acknowledged by the experts to be an increased risk for things like arrhythmias that may require something like an ICD or perhaps a different medication or perhaps extensive monitoring. So what this slide is really meant to describe to you is the intention of this panel is not just to teach you what you have, it's to give you the opportunity to do something about it. And so each one of these genes, and as science evolves, is intended to not only understand what makes you you and what causes the condition that you have, but give us more information to help you treat it in a customized way. So some of the things that this will help you do, not only customize your personalized medicine, but we know that these genes run through families. And so if you are positive, then there's a high likelihood that someone else in your family is positive. And that may help you get them tested and help them monitoring and get treated, potentially preventing some of the ill side effects of these conditions. The other piece is, as Jeb mentioned, there are therapies that are actually in the works. We certainly don't have a genetic therapy for every disease out there, but we are starting that process, and there's a lot of innovation for genetic cardiomyopathies. Everything that's on our panel encapsulates what's being currently done in science, and hopefully is in the works. So if you're interested in something like understanding what clinical trials are available, knowing what gene potentially causes your disease is a critical part of that. Next. So this talks about who should get tested, and we'll talk specifically about every gene, but essentially every gene mirrors the guidelines. Greg talked about this. So when it comes to who should get tested, this isn't just my opinion. This is based on the experts. Experts in both the US and the EU have gotten together and said, we recognize that there's a huge value in understanding what the genetic basis is of cardiomyopathies. So if you have heart disease of unknown cause, if it's not hypertension or you haven't had a heart attack and we can't really figure out why you have heart failure, then there's really kind of speculation that it might be genetics, and that genetic piece could help us better customize your care. And so when you start to think about who should be taking the Every Gene panel, you really should think about it. If you haven't been tested and you have been diagnosed with an unknown heart failure, you may see the word idiopathic. What that means is we don't understand what happened, why you have this. And so that might be an option for you to get tested. The other piece is I want to talk about the idea of getting retested. So when you saw the panel that we developed with Mass General Brigham, that's something that we developed within the last several months. So it reflects the most current data and evidence that drives that panel. So every gene that you see on there is a reflection of the most current research. And that panel changes. It actually changes fairly frequently. So if you have been tested greater than a year ago, you really should consider getting retested, because we learn new things all the time about what genes are connected with what conditions. And I think also it's important to talk about the treatments that are being developed in the space as well. Next slide. Just to drive this point home, these are some of the societies that have all agreed that patients should be tested that have this cardiomyopathy of unknown origin. And recognizing that cardiomyopathy patients can have things like high blood pressure or have had a heart attack or coronary artery disease in the past. It's not to say that that excludes that piece, but the key here is it's not significant enough to cause your heart failure. And so that's why you'll hear the terms idiopathic are unknown for cardiomyopathy. And all of the groups, the societies on the right-hand side of this slide agree that this really should be a part of the care. Now, I will point out, the question could be logically, well, if only 1% have gotten tested, what are the barriers? Well, I think there are a lot of barriers. In fact, there's a lot of surveys from both providers and patients that have been published to better understand what are facilitators of genetic testing and what are barriers. And I think there isn't just one, but I think cost is a part of it, insurance is a part of it, lack of genetic counseling is a part of it. And so Every Gene was really created to solve all of those problems. So we thought about all of that in mind to make sure that you had a process that was easy, that was free, and that made you all feel supported and educated, so that this could be something that you could help navigate as a patient and help connect with your provider to make informed decisions together. Next. So now I'll introduce you to Every Gene. And I'm really kind of honored to be a part of this. This is something, as Greg mentioned, he and I chatted about this years and years ago, really to try to figure out how to solve this problem. And so we recognize that a lot of patients need to get tested, and Every Gene is excited to bring this forward and hopefully do our part to get more patients tested. So what you're looking at here is a screenshot of our website. Jeb will walk you through the process. It's meant to be very easy. It's not meant to be cumbersome. We recognize that that's a barrier to testing, and so we wanted to eliminate all of that. Next. As Jeb mentioned, we had two very important prolific partners in this. So Every Gene doesn't have their own labs. We decided to partner with the best. So what you'll see here is two specific partners that we use here. I'm in the Boston area, and both of these are local to me. So if they're new to you, I want to introduce you to them. So the first one is Broad Clinical Labs. This is the largest sequencing lab in the US, and it's in the Boston area. Everyone you see on the slide works very closely with Harvard and MIT. So these are very world-renowned researchers in both of these departments, both Broad and Mass General Brigham. So you can see the second bullet there is Mass General Brigham, and they have a laboratory for molecular medicine that has helped us not only design this panel, so really we tapped into their expertise to make sure that we had expert geneticists and specifically in cardiology and cardiovascular care help us design this panel that would reflect the most up-to-date research to make sure we had the right genes on this panel to serve the patients. Next. So now moving into the process, what we tried to create at Every Gene was more than just a test. And I will tell you personally, I had my genetic testing done, and I felt confused. I think that it was a challenge for me to understand what my results meant, what questions I needed to ask, how do I talk to my family. I didn't understand what my diagnosis was or wasn't. And so we used my experience as well as the experience of many others. We've talked to a lot of patients and understood their journeys to try to make this as easy as we could. So beyond the testing and the scientific partners that we've utilized to make sure we bring you the highest quality test, we wanted to make sure that once you got those results, you knew how to interpret them and what next to do. So I'll just start to talk through some of these. We'll go into them in greater detail, but the intention is to make sure that when you get these results, they're in a language that you can understand. And so you will receive a very technical report, and that can be handed to your provider, but you'll also get an action plan as a patient to help you understand what questions you need to talk to your doctor about. How do you talk about this with your family? What are some frequently asked questions about having a genetic variant in cardiomyopathy, and what are the things that you might want to worry about or not worry about? So we'll have all that in a bundle to help you. And all of that is going to be a part of the portal that you'll be able to enter as a patient. So you'll create your own login, and you'll have access to all of the educational material or results within our portal, and Jeb will walk you through that. The other thing is all of these things are shareable, so you'll be able to share them with your family. The intention is not to have you do this alone. The intention is to bring this back to your provider, and there's all instructions in there to make sure that you know what to share with your provider, what exactly to send. You can download it in a PDF and put it into your MyChart. There's all sorts of instructions there to make sure that you understand what to do and how to make it easy. I mentioned the personalized, sorry, Jeb. I mentioned the personalized action plan, so that's a part of it, kind of making sure that you're supported. And then last, but certainly not least, is the genetic counseling. So we recognize that has been a big barrier to testing uptake, and genetic counselors are trained and licensed to help you navigate results and understand next steps. So as a part of this process, anyone who has a positive test will get free genetic counseling within the portal. Next. So important question, who is eligible? I mentioned this earlier as far as what the guidelines say, and we want to mirror that. So this is small. I I can't see anything anyway. My sight has gone down the tubes in the last decade, but I will use my readers to tell you that this very much reflects what I shared with the society guidance. So we're looking for patients that are adults that have been diagnosed with cardiomyopathy, meaning we don't know why you have this, or you might hear the term idiopathic. You could have been tested in the past. You could have been tested, not tested in the past. We'll take all of those because we recognize that the value of our most updated test has a great importance to you as a patient. So regardless of whether you've been tested, you are eligible if you are an adult with cardiomyopathy. And the details here help describe that, just in case you don't remember exactly what I'm saying, but it repeats what the notion of it is. Next. So this is what happens when you sign up for this. And again, Jeb will walk you through how this works, but it's a couple clicks, and then you'll get your kit in the mail. So this will be sent to you in the mail, and you will get instructions on what to do here. It will go right to your house. You swab your cheek, put it back in the kit, and you'll get a full genetic analysis. You send it right back. And as I mentioned, all of the results will be in your portal, meaning you have to create a unique login, access it through your portal. Genetic counseling will be a part of that too. I believe virtual counseling through the portal, and you'll get your personalized action plan. So there's no insurance here. There's no bill that will come later or no hidden cost. It is absolutely free. Next. So I mentioned a little bit of the steps, but you'll register here. Like I said, you click on eligible, you hit a yes. It will say, congratulations, you've qualified for our test. You register, so you have to let us know where to send the kit. And then you'll receive your kit at your house, and it will show you the instructions. You're going to swab and mail it back. And within the portal, it will tell you, just like my favorite Amazon app that will tell me exactly where the truck will be, it will tell you within the portal when you can expect your results. So it will show kind of your pending. So let's just assume right now that you've had your test and you have now your results. And I want to kind of show you a little more of the details that you'll receive to support you through the process. Next. So I mentioned that you're going to get results. And when I went through this process, I found that the results were very overwhelming because they were in technical terms that I didn't understand. So our intention is to certainly provide that level of technical detail, but also provide you the ability to understand what these results mean for you. So you will get the official genetic report, and this is all something that's designed to be shareable with your provider. So you want to make sure that you share that with them. Positive patients will also get a clinical summary letter, which is more of a overview of the condition as it's linked to your gene and what potential treatments are guideline directed. So there's additional things that will happen with positive, all of which will be in the portal and all of which will have very clear instructions so you know exactly what you need to bring to your provider. What's important too is that you will get what you need to be able to navigate this. So you will get a personalized action plan with your results explained. And this will help you navigate what these results mean to you. What is this gene? What does it even do? How does it affect my condition? What do I need to know as far as talking to my family, talking to my provider, and what are things that I need to anticipate going forward? That's all customized to you based on your results. And then I mentioned the genetic counseling. This is something that you will sign up for. There's a chat feature within the portal. They'll chat with you to schedule a time. You will have a live face-to-face, Zoom call with the genetic counselor. And if you have questions beyond that point, which I feel like, frankly, I certainly did, you'll be able to chat with them through that feature beyond that point for the next month. So don't feel like you have to squeeze it all in 30 minutes. Know that the intention here is to support you to make sure that you get all your questions answered. Next question. So a big one here. What about family? Recognizing that these genes are something that you certainly pass down. So when it comes to who genetic diseases or conditions like genetic cardiomyopathy affect, it's really mostly first-degree relatives. But certainly can affect beyond that point. So you want to think about that in that type of circle. And that information was something that the genetic counselors will walk you through. Now, with regards to every gene in our free testing, we would love to be able to test everybody, both patients and family members. But recognizing that patients, there are so many patients that haven't been tested and that could get customized treatment if they did get tested. We wanted to prioritize right now just because our tests are not unlimited. So what we are able to do and offer here is the same type of process and services, and we can do it at a discounted rate. So what you can see here is our discounted rate for family testing. Something that we do and grow as a company as we figure out how to fund more tests. We understand that cascade testing and family testing plays a big role here. So please know that that isn't lost on us. But at this point, this is what we're happy to offer for patients, family members. So know this is a part of it. Next. And last but not least here is data privacy. So we know that this is critically important. We are a healthcare company, just like one of your providers or your clinics that you may go to and see, hospital, et cetera. And so we are held to the same standards as they are. So we're held to HIPAA. We have to have secure servers. We are a lab company. We are taking your sample and we're processing your genes. So it's very, very important to us that everything stays secure and private. There are two elements of your information that we will be keeping to help you. What you can see on the left-hand side is your contact information and your genetic variant. Why that's important to us is it's the way that you are linked to the portal, and it's how we know what reports to give you, and how if you're interested, we can contact you if your genetic information changes, if a test gets updated, if there's research involved, and elements that those are all optional, what I'm mentioning to you right now. On the right-hand side is your health information. Now, we will be collecting your health information to give to the genetic counselor because the genetic counselor needs to be able to customize your chat. They need to understand what medical history you have, how this affects your cardiomyopathy, how long ago you got diagnosed, because they're going to help navigate the next steps for you as you not only intellectualize this as a patient, but share with your provider. We do not keep that information. What we do is we strip it all of your personal information, your name, your date of birth, your address, all of that stuff gets completely wiped. And the elements within it are put into a combined database together with other patients just like you, so that we can understand what is important to patients that have your gene and how we can advance research. So know that the piece on the right is completely disconnected from you, and elements are pooled with other patients so that we can evolve science. The piece on the left is something that you can always opt out of or remove, But for the genetic counseling portion, the health records overall are critically important to that customization. Next. There you go. I'll pass it to you, Jeb.
Thanks, Megan. Great. Can you see my screen, Megan? Yes.
Yes.
Wonderful. Okay. All right. So as Megan mentioned, and what we've worked the last really 18 months on is, and when Greg introduced me, he's right. Just getting sequencing, testing, and counseling for an average person, let alone a patient, is almost impossible. Even though knowing that the costs are so low, getting this app information accessed in a reasonable, fast, easy to access, low cost way just didn't really exist. And so we've tried it. We spent the last 18 months trying to solve all of the problems that we encountered when we're getting a genetic test. One is cost. Two is how fast and easy it is to order and get results. And three is how easy is it to understand your results and next steps and get ongoing support? Because I feel like there's a lot of examples of people who have a genetic variant, but then that's the last step. They don't really know what to do next. So we've created this platform as such. I think I'm not going to read through the entire website, but it's a very quick and easy website that just basically shows how we make genetic testing easy. One of the key highlights is for providers. So as we're trying to start a movement of getting genetic testing in the hands of providers and getting free tests out there to anyone diagnosed with non-ischemic or idiopathic cardiomyopathy, we have a providers page. If there's any providers on the call right now, please, you can order unlimited kits to your office. Just let us know how many you need. There's an order form at the bottom. It takes about 1 minute to fill out max. Our test spec is up here. I don't know if I bring up this PDF, if it will actually pop up as shareable. But I brought it up, and it's the entire test spec, which shows the strategy, the genes, the methodology, any limitations, and the clinical sensitivities. So going back to just the providers page, we want to support support your patients. So please let us do that in any way we can. We would love to hear from you. The About page, we won't go into. The FAQ should answer a lot of the questions you may still have. So just in terms of how long does it take to receive test results? It's 8 to 10 weeks right now because we are just starting out and this is day one. We should be able to get that down in half as soon as possible. But I don't want to promise that and not deliver it. We're at 8 to 10 weeks right now. We hope to get it to 4 to 5 as soon as possible. But just any other questions you might have should be answered here. You can email support@everygene.com or me directly, jeb@everygene.com, if you have any questions, and we'd be happy to answer them within a minute. So please do. Okay, so just walking you through the actual process to get a test. As Megan pointed out, it's the Get Your Test button. And we ask patients to certify that they have been diagnosed with cardiomyopathy. And then we have one question. This is the longest text we have in our entire website. It just explains that what non-ischemic or idiopathic cardiomyopathy is, which means that the doctor who diagnosed you couldn't identify the cause of the cardiomyopathy and suggested it may have a genetic component. So if you hit yes, then you qualify. The next is your details, and I will do that now. Okay. I've already ordered a box and received my email that confirms that I've ordered the box. And then I am now confirming that I've created an account. So I'm just checking my email, which you can't see right now, and I'm verifying my email. Megan, can you see the portal now?
Yep.
Okay, great. So right now it's register your kit. So your kit will arrive in the mail. If a provider has given you a kit, you will have the barcode waiting for you. because you have the kit, and you would enter a 14-digit barcode and hit next. Right away, you can see that you can add family testing. So you could buy kits for any of your family members. And again, this is at a discounted rate to what we pay. So it's partially still subsidized. We just wanted to prioritize all of the first 5,000 tests going out to patients who currently have cardiomyopathy and could use a genetic test. That's why we charge anything. We would love to make this free as soon as possible. In terms of just what else you can do, in terms of registering your kit, I'm not going to walk through that process, but it's as you would imagine. Megan mentioned something about opportunities for research, and we don't ever give your information out to anyone. That's not how it works. If someone has a research opportunity or some sort of opportunity, they can ask us if there are patients that could potentially benefit from this opportunity. We would then send you a message in our portal here, and you can take a look. You can turn off messages. You don't ever need us to contact you. It's all opt-in. And for any of the opportunities, we would help you do anything you want to do if you emailed us. But for the most part, we're not. There's no pressure to do anything. This is literally just trying to connect people who are working to cure genetic disease with those people who have genetic disease, and we'll do that in any way we can without causing pressure on either side of the equation. So the next part is the results tab. Your results will appear here. This is a pretty frame that basically has a chat functionality with your genetic counselor, and it's where the results get posted. You can also turn off messages. You can just customize whatever you want in this portal, but basically this is where you communicate with your genetic counselor and see your results. Explore Trials is once your results have been uploaded, and we set it now so you can see, it just posts what's available. We will stack rank these for you in order of your genetic variant, just to bring the most relevant trials to the top for you. Again, there's no pressure to participate in any clinical trial. One of the things I learned about clinical trials is not all clinical trials are interventional. Many are observational, which don't require a drug at all. So there's a lot of value that can be created from people without taking drugs, as well as those who do take a drug to push science forward faster. But we're just here to facilitate that meeting between people who are working to cure disease and those who have disease. There is no pressure or obligation to participate whatsoever. And then, of course, we have FAQ. And ultimately, the goal is one more feature, just so you can see it. You can delete your account at any time, and you can update your account info. You can see what you've ordered. And last is you can download your genetic code. So just kind of circling back to what I said at the beginning, your 3.2 billion base pairs that make you are in the form of a VCF file can be yours here. And then if other services ever came along that you wanted to upload your VCF file into, we are all for that. We want you to have as much information about yourself as you possibly can. And that is the entire portal. I think this was all designed with not, just making it simplistic and easy to use. And we are just getting started. So we are humble and open to feedback in any sort of way. If there's anything we can do better, or there's a feature you'd like to see in our portal that would make your life easier, please send us an email. We would love that feedback and be very grateful for it. So Megan, with that, I'm going to turn back to the presentation. I think we go back to Greg after this. So I'm just going to log out and stop sharing.
That's great. And I know there's a lot of questions coming in. Know that we'll have a Q&A session to be able to answer these. So we really appreciate all of it. I know it's a lot. Okay, so I think this is the most exciting part, to be able to share with you our website. So you can either go to the website, everygene.com. It doesn't have to be on a phone. It could be on a tablet. It could be on a laptop, whatever you want to do to get the internet. Or you could take a picture of the QR code and go right there, and you'll be able to pop up exactly what Jeb shared. As he mentioned, if you have any questions that we don't address tonight, or you think of something later, just email us. We're here. And the intention is to make this for all of you. So we want your feedback. If something, if you have a question or something's confusing or you need our help, don't hesitate to reach out. Last but not least, we want to share a very special thanks to two amazing groups. First and foremost, The testing that Greg shared with you, we have 5,000 plus tests, was funded by patients and families that have the condition and that are dedicated and passionate about helping all of you figure this out together. So we are very, very thankful to that special group that has made all of this possible. In addition, we want to give a shout out to an amazing group of life science leaders and scientists and researchers that are pushing science forward in the space. And so we have given a name to that group. It's the Cardiomyopathy Collective. And they too are adding funds to be able to fund more testing. Every dollar we make as a company goes more to more testing. Our intention is to be able to test every patient and family member that needs it. We're starting with patients, and the hope is to grow and grow and grow and be able to give free testing for family as well. But right now we can give you the discounted piece. So know that the Cardiomyopathy Collective is a really important part of that to be able to help with funding and innovate together to be able to move science forward.
Hold on. Turning it back to Greg.
Perfect. Hey, Megan and Jeb, that was great. Wonderful, very informative, and extremely, extremely exciting. Thank you. Next, and we're probably going to run a little bit long. We have a lot of questions. We're going to keep on here and answer the questions. We think a lot of them are really, all the questions are good and should be answered live. So if you're willing, hang on with us past 7 p.m. Eastern, and we'll get to all the questions. But before that, I'd love to introduce two folks that are huge advocates in the cardiomyopathy community that are both part of GCAC and strong supporters of helping patients with cardiomyopathy and genetic cardiomyopathy. First, we're going to hear from Bethany Keim, founder, co-founder of Heart Charge, which helps with patients to help alleviate potential sudden cardiac arrest in individuals and those with undiagnosed heart conditions. And then we'll hear from Jenny Shea, the co-founder and president of the Danon Foundation, which represents genetic cardiomyopathy also. Next slide, Bethany. We'd love to hear from you.
Hi, I think my video is disabled, but I'll just speak if that's okay. Okay, now did it start?
Go ahead.
So sorry, traffic and time is not on my side this evening, but I'm so excited to be a part of this and to be here. And I just wanted to share how genetic testing has helped my family and has actually saved my sister's life. So I'm the 7th of 9 children from a family which we found out due to genetic testing is riddled with HCM. We're a testament to how genetic testing saves lives and guides treatment. My aunt finding out she had genetic HCM led to my sister and I being diagnosed, which led to us being treated, including with implanted defibrillators, which led to my sister, Hannah, surviving sudden cardiac arrest in her sleep. We know how many other stories of friends with that short distance between genetic testing and survival. Our diagnosis led to our mother being diagnosed, which finally explained her many trips to the emergency room with intense arrhythmias, which were repeatedly dismissed. Genetic testing leads to explanations and saves lives. Genetic testing can also bring relief and help plan for the future. Currently, I'm in New York visiting with my little sister who just graduated college. Due to Hannah and I, we were dancers before we were diagnosed with HCM, but because of our diagnosis, that was sidelined and we could no longer be dancers. But our little sister got genetic testing and she's actually a dancer and just graduated with her dance degree. So it's incredible that genetic testing can help you plan for your future if you do it ahead of time. In my family, genetic testing has brought so many answers, and we actually have a few brothers that carry the gene for HCM but do not express it. And I'm so grateful to be a part of this and just for what the future is in store with genetic testing.
Thank you, Bethany, so much, and appreciate all the things you're doing with patients and for being here this evening. The next is Jenny.
Hi, everyone. Thanks for having me. I represent a community called the Danon disease community. It's a rare genetic disorder that caused by the LAMP2 gene mutation, and it causes cardiomyopathy. And that's really how people are typically diagnosed, is with HCM or DCM. And it's a very rare disease, and there is no cure today. So for us as a foundation, we're working really hard to get people tested and understand a little bit more about this very rare disease, so that they can be empowered to make better health decisions about whether it is what kind of treatment or what kind of healthcare they need. And it's something that we've been doing for the last 8 or so years. But I'll give an example of why this effort and the work that GCAC and Everygene is doing is so important. In rare disease, it takes about 7 years to get a real diagnosis. So for us, it takes a while. It's not just cardiomyopathy. Danon disease, presents with other issues like muscle weakness, intellectual disabilities, eye disease. And oftentimes for our community, we're not treated as a whole person. We're treated by our body parts, and typically it's cardiomyopathy. And so for us, this is such an empowering moment to really give people that option and that access to testing. I'll just give a couple of examples of things that I feel great about in terms of what we're doing and what this team is doing here today. First of all, when I was getting my genetic testing, years ago, it cost over $2,000 easily. And that was the biggest concern that my genetic counselor had. More than my results or anything else about access to information, it was, thank goodness your insurance covers it, let's go forward. So I think we're really addressing an unmet need here. And I think it's intentional, especially given some of the complexities of the healthcare system. Secondly, I was diagnosed and learned about my gene mutation years ago, and I had my kids tested. And I think, the technology, the quality of testing has changed over time. And so this idea of being retested is really important, because I've heard time and time again in passing that, oh, maybe you should get your kids retested because that test might not be accurate. And I think the quality and the backing of real world renowned institutions is giving me comfort, because I don't have to do this every couple of years. I have the information there. And lastly, when I was given my genetic results, it's like Megan was saying, there's so much information that's medical jargon and genetic information that I couldn't interpret or decipher. And it's really daunting when you have that information in front of you, but don't know what to do with it. So I think there's a couple of things that Everygene and GCAC and the team here is really trying to solve. And I find it to be really remarkable how quickly things have come together. And then lastly, for the rare disease community and cardiomyopathy in general, I think this information can be so powerful in terms of research and learning more, whether it's the ability to participate in research and be part of a natural history study, be part of a clinical trial. These are all things that that we in the rare disease community look for, because we have no cure and we don't have enough information today to really understand our disease. So I applaud the efforts of the team here, and appreciate you guys inviting me to speak and share a little bit about the Danon Foundation and what this means for us as a community. So thank you.
Thanks, Jenny. Appreciate it very, very much. And Bethany, also your partnership and cooperation. We've got a ton of questions. We're going to go long. We'd love for you to stick with us, but we think all these questions are important. We've answered some online, but I think it's important for a lot of these to be answered. Megan, I'm going to shoot the questions to you. If you want to defer to Jeb,
Sounds good.
feel free to do so. But I think we'll run through this pretty quickly. First question, and I want to bring out, is how is this funded? It's funded by patients that have the disease and people involved with it. So we're very excited about that. I am an investor, and because I think it's a very important thing that problem that we solve here. So let's run through these. Megan, is this free genetic testing program only for DCM patients or also HOCM patients?
So this is for patients with cardiomyopathy. So that could be hypertrophic, arrhythmogenic, restrictive, amyloid-based. If you have cardiomyopathy, then this is the test for you. And the test was created with the idea that it wasn't just one type of cardiomyopathy. And what the scientists are actually thinking, and your cardiologist may be thinking this as well, because the leaders in the space are realizing that there's a lot of overlap. If you notice what our panel looks like, it's a Venn diagram. So some of the genes can look like dilated cardiomyopathy, some or hypertrophic cardiomyopathy. It may change based on what gene you have. So what they're leaning towards is instead of calling it dilated or hypertrophic, they're leaning towards it being a gene and then cardiomyopathy. Because the more we can better understand what the condition means for you, the better we can personalize the treatment. So it's all types of cardiomyopathy that can use the panel and can benefit from it.
Perfect. Thank you. Huge question everybody's thinking about. Can you speak about data security privacy policies of every gene? Do you share with any third parties? How is the data stored? Worrying about previous issues with companies like 23andMe and Ancestry DNA.
Yeah, so this is a different, we approach this with a mindset of acting like a hospital. So we have to do that with the same security and privacy measures. All of our policies are embedded within the website, so you can see that as a part of the consenting process, so you understand that we operate just like one of your hospitals would with regards to security. When it comes to data sharing, there were some questions about selling it to the federal government and things like that. We don't do that. We use your health records to better allow the genetic counselors to give you a customized piece. And then after that point, all of the identity is stripped from it, so it can't be connected with you. The only piece that we keep identified is your identity within the portal so that we can contact you. If you want to remove that piece, that is completely up to you. The negative part of that is that if there are changes in the genetic panel or there are updates that you need to know about your genetic testing, we won't be able to contact you. The other piece is if you are interested in learning more about research or educational opportunities, we will not be able to connect with you. But beyond that, that's the only piece that has your identifiable information and can link you to you.
That's great. Perfect. Thank you. And you have the information, I think, on the website about that too, so if people want to visit that. Is it as simple as getting a script for the test from my cardiologist, and will insurance cover it?
So you don't need a script. You are eligible based on the idea that you have cardiomyopathy. And cardiomyopathy is defined by not having a heart attack or blood pressure issues or other things that would have driven your heart failure. Know that there is a script that's required, and that's part of the partnership that we have with the genetic counseling and clinicians. So they will use your medical record to make sure that you meet the qualifications so that that script can be written to a lab. But you do not have to submit any health records. You don't have to sign a medical release. The intention of all of this was to make this really, really easy. So we don't need you to upload anything. We just need you to attest that you have cardiomyopathy, and a part of that process will make sure that the genetic counseling team and the clinician that's writing that script to the lab, Mass General Brigham, will make sure that you fit that criteria.
Great. Thanks. Another question, again, there was a question about selling the information to the federal government. The answer obviously is no. While talking about the need for testing, can you expand a little bit on the need for data from the test for therapies that could potentially help everyone? Why is this important for future therapy development?
Yeah, this is a really important question. And as Greg mentioned, so my role in the last couple of years was to design trials for genetic cardiomyopathy. And what I really liked about that process was it was my job to understand the patients that have this disease so that I could make sure that our medication worked in a way that mattered to them. And the thing that gave them their voice was their health records. So I needed to understand what it felt like to have that type of genetic cardiomyopathy. Were they admitted to the hospital a lot? What happened with their echo? Did their ejection fraction go low? Did they have arrhythmogenic problems? Did their defibrillator go off? I needed to understand what it felt like to be those patients so that I could create a medication in a trial that would match their need. And beyond what I loved about this process is research didn't just come from what I needed. I had to prove it, right? So I had to bring it to the FDA to be able to say, this isn't just a hunch. Here is the data that shows that this is what it feels like to be this patient. This is what matters to them. And this is how our medication changes this. So for every step in the process to bring a drug forward, from the animal models to the first in human to phase 1, 2, 3, to bringing it to you on the shelf, you have to justify that the drug works in a way that matters to patients. And the way to get your experience through is through your medical health records. And so that's why this data is so important. So when I say that building a pool of patients that have DSP or lamin to better understand what it feels like to be this person, and again, your name's all removed, your address, all of that is gone. But what we can look at is, what do their EKGs look like? What do their echoes look like? Do they get admitted? How frequently do they go to the emergency room? How fast do they get sick? Do a lot of them have atrial fibrillation or hypertension? What do we need to solve for to make their lives better? And Jenny even shared a lot of information about what it feels like to be a Danon patient. It's more than just a cardiac issue. So researchers like I was at the time needed to better understand what it felt like to be a Danon patient so that we could prove to the FDA and to all of you that our medication works in ways that matters to you. And we can't do that without information, and we can't do that without testing. So when I see that 99% of the patients haven't been tested, I wonder, as a researcher and a scientist that is invested in making innovation to help patients, what this could look like if I knew what it felt like for 99% of the patients that haven't been tested. If we really understood what it felt like to be all of you. So it's very intimately linked, and it's important that we as researchers and innovators in the space can design medicines that speak to your need, and we need your voice to come through the health records to do that.
Greg, do you mind just because I know what we should answer all these. These are all such good questions. I have a few that I can just reel off that are very quick, if that's okay.
Sure.
All right. So just there's a DSP cardiomyopathy patient. Adult children need to get tested. They have not seen a cardiologist yet. Will they be eligible for free or reduced price testing? Yes, they're eligible for family testing, and we would absolutely encourage you to get them tested as soon as possible. You don't need to enter your this is at 633, 634 is you don't need to enter your personal health information into the portal at all. And then just a few more.
Yeah, let me roll with these, Jim. Let me roll with these, Jim. Okay. First of all, what is considered adult and why only adults?
So it's 18 and above. And it's really because we're in the beginning stages of this. So there was a question about international patients and children. We are working to expand all of this, but for right now, we are doing this for 18 and above at this point. But know that this is an interest in everybody, so we're working to be able to expand it.
Perfect. And I think, Jeb, you were saying about, do you need to enter any personal information in the health portal? I think you've sort of, go ahead. I think you've sort of answered that, but go ahead.
Yeah, no, Greg, I'm sorry to cut in. I was just trying to, I know we're short on time. So
Yeah, we're going to try to roll through as many as we can, and we may go to 7:30 if you guys don't mind, if people want.
Yeah, I would actually like to answer all of these if possible. So let's keep going.
Cool. And Megan, I think you answered the personal health information and why and why it's needed. Thank you. Again, I wasn't diagnosed with idiopathic cardiomyopathy, but I'd like to get tested, especially because I lost my youngest brother at age 34 to sudden cardiac death. What could I be, could I be eligible?
So at this point, you would be considered potentially a family member. I will tell you that I had a friend that had a similar experience. Her family member died 10 years ago of sudden cardiac death and had signs of hypertrophic cardiomyopathy, but the testing was negative. They saved his blood. I don't know about your family member, and I'm sorry to hear about that. But if they were able to save anything, but in my family members, in my friend's story, they got retested 10 years later. They had discovered the variant that her brother had, that she now has, that her child has. So science evolves. Right now, the intention is to provide free testing for patients that actually have the condition. But do some digging a little bit and see if you'd be a potential family member that could benefit from this.
Based on what you're saying, this is for Sam. If given this story, can you just email us? We'll make sure you get a test. Whether we do the family or the regular, we can discuss. But we want to get you tested, and we don't want you're on this.
Perfect. Is that what is the email there? If you could ask, is it info@everygene?
Sorry, Greg. It's support@everygene.com or Jeb or Megan, MEGAN. Any of those work. We'll make sure you're taken care of.
Perfect. That's wonderful. Thanks. Hey, my daughter's out of the country till October. Will she be eligible then to get tested, as I am a cardiomyopathy patient? So
if your daughter has cardiomyopathy, she would be eligible for the free piece. And the family testing is really for those that have found a variant. So the intention here is we want to make sure that you get a benefit out of the testing. So if you don't have a variant yet, your family members, it's not necessarily recommended that your family members get the testing. But if you haven't been tested, I recommend that you get tested, figure out that piece, and then potentially your family members need it too.
Perfect. I don't have a smartphone. Can I do this on my computer or laptop?
Yep. Mobile
can be done from anything. Yeah.
You can go anywhere. Sure.
Perfect. To clarify, you are offering 350 or 349, I think, genetic testing for first-degree relatives only if the program, if variant results are positive. Or will you offer the discounted testing for indeterminate results as well? Great question.
So it's really, you have to look at the evidence and what the experts say. And it's all about you and your benefit. So why would you get tested if you're a family member? And the benefit of a family member getting tested is because they know that they have someone with genetic cardiomyopathy, some sort of gene in their family, and they want to see if they have that specific gene. And if they do have that gene, then they can get additional monitoring. So if your family member doesn't have that gene that's positive, it really doesn't necessarily help you if you get tested. If they have a gene, then as a first-degree family member, you should get tested. And that's what the expertise of the guidelines says.
Perfect. Do family members getting tested need to submit the genetic results of the parent when they apply for genetic testing? Parent, or I guess we call it proband.
No.
Okay, perfect. Testing is available in the U.S. only right now?
For right now, but we recognize that there's great interest, so we are working actively to expand.
Minimum age is 18, I think you mentioned, for testing. Dan said, great program, thank you very much. For family testing, should I consider both my immediate 3 adult children and my 3 grandchildren? Or if none of my immediate children test positive, can the genetic variant skip my children but still develop in my grandchildren? Great question, Dan.
So let's take the first piece. If you are genetically positive, then your first-degree relatives should be tested. But I think that this is also something that shouldn't come from me, right? This is a conversation to have with your family, with your genetic counselor, with your provider. And that's the intention here, is that this isn't a mandatory thing. This is about information. Some people don't want to know, right? So this is a conversation that needs to be informed through all of you. And genetic counseling will really help you be able to navigate all of those levels. You mentioned grandkids and family planning as a part of this. If you want to get pregnant, you want to know. But the intention is for you to be able to go back to your provider and team and your genetic counselors to be able to make those decisions together. But the guidance, and that's why we created this family testing, is that first-degree relatives should be considered for testing.
Great, thank you. I may have missed this. Do you require medical records or confirmation of a diagnosis for someone in order to order the genetic testing?
No, the ordering provider takes care of that. And then the question on secondary findings, the answer is yes. Assuming you're talking about the ACMG 84 genes now, we will be adding that as an additional option in the next 3 months. So the option is not there now, but there will be the option to add secondary findings.
Perfect. Thank you. Is the genetic counseling live or AI?
So it's live.
It's a licensed genetic counselor.
There's licensed genetic counselors in all 50 states. It is a live session. And like I said, if you feel like you have more questions after that point, you have a month to be able to chat with them asynchronously, but it's not AI, it's a real person.
And is the genetic counseling free also as part of it?
It is. And who's providing it? It's we partnered with DNA Visit, who has licensed genetic counselors in 50 states. We we've worked with them to develop the program to discuss this specific test. This whole test and program where genetic counselors are speaking intelligently about what we're offering has been developed over 6 months. So yes.
Perfect. Is the genetic testing free for immediate? We've sort of answered it, but the question keeps coming up. Is the genetic testing free for immediate relative like sisters? If I tested positive for cardiomyopathy gene myself, or would they need to pay the $350?
So the free testing is for patients that actually have the condition, meaning they have a diagnosed cardiomyopathy, they have a cardiac condition. If you are a first-degree relative of that person, but you haven't been diagnosed with the condition, then you would be in the family piece and be eligible for the 349.
Great, great. My maternal grandmother, my mother, and myself have an ICD. They died young. I got 2 heart transplants. Myself and my kids were tested 10 years ago. They found 2 known genes in me, both of those in my youngest son, and one of the known plus one of the uncertain genes in my older son. Can they get tested? They've not been diagnosed. They certainly have the genetic makeup. So it sounds like they've got the,
They've been tested without diagnosis. Yes, you can definitely get retested with the latest gene panel through every gene, and they can get tested for free.
Okay, perfect. Are we able to get 2 kits if 2 people in the family have unknown cardiomyopathy?
I'm not sure what.
So I think
Each individual
in the same
person.
household.
Oh, yeah. So the portal is designed so that an individual can go in. You can't order 2 because it's personalized to you. So you can go in separately on different iPhones and create your account.
Perfect. That's wonderful. Any plans to enter the EU at some point?
Yep, we're working on it.
Yeah.
Perfect.
That will take several months, but yes, we are working on it.
So how do family members request a kit if they have not been seen by a doctor yet?
So if you are a family member of a proband, right? So that means that someone in your family has been diagnosed with genetic cardiomyopathy. So there is a link, and you are attesting that you have someone in your family that has a genetic cardiomyopathy. Then you are eligible to be able to get that. And we have providers on our end that are able to link those pieces together.
I'm so sorry to cut in. I think she meant, or he meant, how do I actually get it? And so if you have been tested through every gene and have tested positive, the first thing you see is the widget in the portal for family testing. So you can order all of your family testing on the first screen when you enter the portal. You can get family testing. So just know that.
Perfect. If you've tested positive for genetic variant associated with DCM and you were tested over a year ago but do not have heart failure, are you eligible for free testing?
So if you're a patient with DCM, that means you've been diagnosed with a cardiac condition. Yes. And it sounds like you've been tested over a year ago. So our panel, it probably reflects additional genes that may not have been tested in your case.
Okay. If you had a positive gene variant but underwent a heart transplant, are you still eligible for a retest for free?
Sure. If you have cardiomyopathy, especially if you had a transplant, these panels evolve. So you want to see if you can figure out whether there's a gene associated with your heart failure.
Yeah. What if the diagnosing doctor didn't suggest the cardiomyopathy might be genetic origin? Mine just said it was non-ischemic. Again, I can answer that. We hear from patients all the time. Most cardiologists do not understand the guidelines. Most cardiologists do not understand genetics and cardiomyopathy. And I have heard, not 1,000 times, but I've heard hundreds of times from patients that say, my doctor said I didn't need to get genetic testing, and they're just flat out wrong. So, if you meet the criteria talked about today, you can go ahead and get it ordered if you would like. I have a known genetic variant for ACM. Can I pay the extra charge to have my daughter tested? She needs this for so long, it won't get it due to the cost. Yeah.
Yes, it should be an eligible family member.
Yeah. What happens with VUS results that get updated? What would be circumstances that VUS would be reported?
So that's a very good question and something that's really important. So what the panel that we've created represents are genes that are linked to a condition. But when we look at your individual gene, we have to figure out whether that change is substantial enough to cause something. And what VUS means is a variant of unknown significance. There's a change, but we don't necessarily know if it's causing your cardiomyopathy. And so those can change over time. So what we are going to report to you is we know that you have this gene and it has caused this cardiomyopathy. If there's a question mark, we are not going to proactively share that with you for the reason that it confuses people. But if we stay connected with you, we can let you know if any of those things change. And the intention was to make this less confusing for everybody. And frankly, in talking to a lot of patients and providers, this was a sigh of relief because you don't know what to do with these variants of unknown significance because you're not saying yes or no. You're just saying, I see a change and I don't know what it means. So we are sharing with you results that are actionable, meaning this is a gene, we know it causes this. But the reason why it's important for you to stay connected with us is if those variants of unknown significance suddenly become something that are significant and we know, we want to be able to connect with you.
Perfect, thanks. How do industry professionals with new research opportunities connect with Evergene to work together to inform patients about available trials?
So we do work with life science partners really closely. But know that as a patient that's a part of this portal, we are a little bit of a middleman here. We are never going to give out your contact information to pharmaceutical companies, but we also recognize that it's important for you to know what works, what trials are available, and what research opportunities are available to you. One of the things that you might have seen in the portal is there's actually a clinical trial finder that's customized to you, to your cardiomyopathy, and to your variant. So it's important for you to be able to navigate that and figure out what matters to you as a patient with regards to innovation. There is an opportunity for us to partner with pharma if you are interested to be able to message you through our portal. We would be the ones that would actually be contacting you if there's new educational opportunities or research. None of this would ever be marketing. This is all science and research because we all are kind of trying to figure out how to advance science together. And that is how the partnership would work, to be able to connect through patients, to be able to understand, like I said, this kind of what your gene means to scientists that are trying to study these genes and evolve research and innovation and new therapies. They're going to want to understand what it feels like to have DSP or lamin A. And that's why that pool of information that removes all of your personal identity could really help drive some of those scientific pieces.
Perfect, thank you. Are folks with idiopathic LVNC also eligible?
So that's a good question. There are genes on our panel that are attributed to that. So it is certainly something that could be beneficial to you.
Thank you. We mentioned before, but probably good to mention again, who is subsidizing this testing?
Yeah, so we have, I mentioned it before, we have an amazing group of patients and their family members, cardiomyopathy patients that have been able to do this for all of you. And so the intention here is to work together to understand what genes are driving your conditions and how we can all drive science forward collectively as a group. So we're incredibly appreciative to that group to be able to bring these testing to you.
Perfect. What will the samples be kept to be run again as more genes are discovered related to CM?
No, so one of the things about getting your whole genome sequence is that code is stable, and you would have the test could be run on the sequence again without having to resubmit saliva. I think one of the key things that we do is called confirmation, which is we'll rerun your sample if we see a positive. So in very rare instances, we always have to have enough DNA to just rerun the sample to confirm a positive. But after that, the DNA is destroyed. Like we're not keeping a biobank or samples at all. So we may run your sample twice to confirm the variant, but we're not keeping the sample, and you would never have to submit a second sample unless for whatever reason we didn't have enough DNA from the first one.
Perfect. What information is provided for conditions like HCM, DCM, and ACM that have clinical screening recommendation for family members, even if an underlying genetic cause is not identified?
I don't know if I understand that.
Yeah, I'm not sure I understand that. I think maybe, so basically, the guidelines are if you're diagnosed with idiopathic or non-ischemic cardiomyopathy, we don't know what caused cardiomyopathy, suggested genetic testing. Then if you have a positive variant, family members, first-degree relatives should be tested. Hopefully that answers the question.
Yep.
Someone said it might be useful to explain the results of categories that every gene uses, positive, indeterminate, negative. So when someone gets a test, what are the I think there's 4 results that the test could show.
So we don't like the terms positive and negative, because I think the challenge is it makes it feel like if you're negative, that means there's not a single gene in your body that has a problem. And we just don't know if that's the truth. What we're reporting to you are your findings. Did we find something? We found something that a change that causes a disease. So you'll see the terminology in the bundle of information we give you. You'll see that there was a finding of a variant that is linked to a condition. And if we don't find anything, then there are no findings. But again, we're only connecting right now the changes that we know that are linked to a condition, and it also only reflects what we test you for. And that's the value of retesting, because if you tested 10 genes 10 years ago and you were negative, we retest you now on 50 genes and we find something, it only meant that you were negative 10 years ago for what they tested you for. So again, not the terms positive and negative. It's really about the findings. Did we find something that we can confirmably say we have found a gene that is linked to your cardiomyopathy, or did we not find something?
Great. And we're getting to the end here. If you had a heart transplant at MGH in November, tested 10 years ago, but I didn't get the full report because insurance will cover the cost, they should still get tested again. I think you mentioned transplant patients are eligible. So is there an app available, or can you go through the website? Or do you just go through the website? I think the answer is
it's on your phone, and it's not an app. It's a mobile web app, right? So it's just like it's a website that you can go to from any device, and you can go through the whole ordering process from your mobile phone, or you can go to a website, a laptop or a desktop. Either way, it's the same thing, and you should be able to get through the process without much friction.
perfect. Do you report out the VUSs at this point? I believe you've answered it, but Dan,
Nope.
go ahead.
Not at this time, but what we want to do is keep in touch with you, so if something changes, that we can let you know, because they do change over time sometimes.
Agreed. Why keep de-identified medical records after genetic counseling? What will you do with that data?
So that data is collected and pooled with other patients that have the same variant as you do, so that we could share it with researchers. In fact, we actually are planning on partnering with the academic medical facilities as well. So researchers from both the life sciences industry as well as academia are really interested in better understanding your condition so that they can come up with treatments. So again, that database will be something that clusters groups of patients together and will remove all identifying information to be able to advance research.
And as a patient advocate, it's really important that we help. We can be a driver and help finding potential cures, future cures, by participating in future research and stuff like that. It's really, really, really important. What are the credentials of a genetic counselor? We'll go for about 5 more minutes, then we'll be done.
So counselors are licensed by state, which is why it's kind of like a nurse or a physician. You have to be licensed individually by state. So DNA Visit is the group that we work with, and they have licensed genetic counselors in every state.
Great. Tammy just placed an order, thanks us, and she feels lost with the disease like a lot of people. Tammy, reach out to me and maybe I'll get to the right person. If you do info@dcmfoundation.org, I'm happy to talk to you and maybe get you to some people that could help you in your journey with your disease. Are the potential clinical trials you mentioned only at Boston institutions like Mass General or nationwide?
No. So what you'll see inside the portal is, and this isn't just for people that are genetically positive, it's for all cardiomyopathies, but we will customize it based on you. And you can sort. And these trials that are there are not just interventional, meaning there's drugs related, they're also observational. So things like natural history to better understand you, and they're sortable by state. So all of these trials tend to have multiple sites, so you can understand what's closest to your home.
Is there any way to be connected individuals that have the same exact genetic variant to help see learn more about this? Yeah, if you go to geneticcardiomyopathy.org, on our website, we have, I think, about 15, 18 patient groups of different gene-specific Facebook groups. Again, if you want more information, info at DCM Foundation, I can get that to you. Are there any medical companies that are involved at any level?
I can take that.
I don't know what. Yeah, I guess that's an unclear
It's usually
question.
medical device to companies like Medtronic, Boston Scientific, etc.
Yeah, not at this time. I think the goal right now is to drive widespread adoption of genetic testing, period, and in this case for cardiomyopathy. And so no.
Great. So doing this means being part of research studies, ? Or my data going to drug companies to do what Megan described? Yeah, it'd be,
Just repeat that one more time, because
yeah, I think kind of, who potentially could get this data if they sign up. So I think that's what they're kind of saying. Who
yeah.
could
So again, the intention here with the data, and I'm talking about the de-identified data that represents your experience as a genetic cardiomyopathy patient, is to advance science. And so it will, the groups that can have access to it are academic researchers. So we're partnering with academic medical centers and experts across the globe, as well as researchers at life sciences. So we're not talking about the sales team or marketing. We're talking about the researchers that are building the trials. And as somebody that did that myself, this was the missing piece for me to better understand how to build that gene therapy for these patients. So I think it's a testament to the integrity of the research that's done to be able to innovate in this space, that they want to hear the voice of the patients. And so that's what it's used for.
Yeah,
I-
keep going. Jeb, go ahead.
Very quickly, like the goal, every gene is set up as a public benefit company. The goal and the mandate and the reason why Greg and us connected is to try to advance science faster, and we're doing everything possible. With that said, the data is de-identified, so anything that is used to advance science is de-identified and aggregated, and therefore it can't be tied back to an individual. So I just want to make that clear.
I think we've got more questions. What we'll do is answer them after the fact. We'll do a follow-up email with the link, and we'll try to also answer any questions the next few days that you have. We're at 90 minutes, 92 minutes. We've got a few extra things that we need to do. We thank everybody for coming. Nikki, do you want to drive now?
Nikki, please share our contact if you can, if people can get it. Thank you.
And Heather had to jump off. She was the coordinator, and Nikki is now running the deck, but it looks fine. Just keep rolling, Nikki.
All right. Sorry, I was muted there for a moment, so I am back now. Can you see my deck there?
Yeah, it's fine. It's fine.
Okay. So I just want to quickly thank our sponsors that you see on screen here, the logos that you see on screen. Thank you to all of them, and also to the patient partner groups for helping to spread the word about tonight's webinar and for their continued support all year long. As stated earlier, you will receive an email with a recording of tonight's webinar. That email will also include a registration link where you can access the free genetic testing. I know we've shared a lot of information tonight, and if you have additional questions, please reach out or visit the website. We've also included a QR code here. If that makes things a little simpler, you can scan that now. And we also want to let you know we're excited to share that our next webinar will take place on Wednesday, June 18th at 6 o'clock Eastern Time. We'll be sharing some information from Proleo. With Proleo's 24/7 heart monitoring, you could contribute to advancing research, supporting better informed treatment decisions and helping your care team understand your own condition. And we'll share more about this opportunity on our June 18th webinar. That registration information is available on the GCAC website, and you can register online now. If you can't attend live, go ahead and register, and you will receive a copy of the recording via email. And thank you. We appreciate the work that Everygene is doing. Thank you, Greg, Megan, Jeb, Bethany, and Jenny. We appreciate your time. Thank you all for tuning in. Be well, and we'll see you in June.
Thank you,
Thanks,
everyone.
Okay, bye-bye.